In this video, we will solve some of the questions, especially the image-based questions of NEET PG 2025. And we will understand what is the art of solving MCQs. During the exam, you won't have complete knowledge. So, I am a third year dermatology resident and I have very limited knowledge regarding the other subjects. So, let's see how to find the keywords and get the correct answer because the answer is right in front of you among the four options. Coming to the first question, a 10-year-old kid presented with orange colored tonsil. From this orange colored tonsil, it goes for 10 years disease. It has orange colored tonsil and it has coronary artery disease. I don't know what all other features are seen. On further examination, HDL is very much less, triglyceride is high, or cholesterol is less. Which of the following is the most likely diagnosis? But from the question stem, the keywords that faculties teaches and are mentioned, the keyword is there orange tonsil. So this is a case of Tangiers disease. Without knowing the everything about Tangiers disease, I knew that Tangiers disease has orange colored tonsil, and that's why I could mark the correct answer. And this is also present in my image bank, and I have mentioned the keyword also orange tonsil, and it is highlighted. That means it is a previous year question. So the digital image bank pro has 1850 plus images. It has more images than core btr also, so you can check it from the link in the comment section and description box below. Coming to the next question, the following epithelium, which of the following is having? So this we can see some umbrella kind of cells, if I am not wrong. So they are in umbrella shape so that they can hold the excessive tension. This is a case of transitional epithelium, so it will be found in ureter. And exactly the same image came in NEET PG 2025, and this was present in my digital image bank. These are not added afterwards. Even I tell you a fact that one of the aspirant asked me that which digital image bank to see just before entering the exam hall. So I said that you can watch the pre and paraclinical subjects, because in NEET PG they tend to give the exact same images of the histology, radiology, these all subjects. So he or she saw this, and after giving the exam he said that exactly this image came in the exam. And how to differentiate it with squamous epithelium, which can be confused because it is also multi-layered. Squamous epithelium, you will get a gradient. Like in the basal layer there is more basophilic, as you go up it becomes more eosinophilic. So you will be able to see a gradient of blue to pink. See this gradient, no one tells this, but I used to identify squamous epithelium by this gradient. Benralizumab is used in the management of asthma. It is by targeting which interleukin? Now, I don't have exact knowledge. Asthma is a Th2 mediated. So, among these three, not TNF alpha because it is Th1 mediated, T helper 1. Th2, if I explain you that a APC is there and a naive T helper cell is there. If the APC secretes your IL-2 or IL-12, then Th1 is formed. It secretes IL-2, IL-12, and IFN gamma, TNF alpha. If IL-4 is there, it is forming T helper 2 cell. It secretes IL-4, IL-5 stimulates eosinophil, this stimulates mast cell, and IL-13. This leads to mucus secretion. And if it is IL-23, then T helper 17 cell is stimulated and it secretes IL-17 and IL-23. So all the interleukins, they have feedback regulation and they have a positive feedback. In this case, we know IL-13 is associated with mucus. So mucus targeting not that much useful in asthma. Okay, so either IL-4 or IL-5. If you are confused between two options, you need to mark the answer. If you are confused between two options, there is no going back. Mark any option. If you are having a first intuition, go with that because 7 out of 10 times it is correct. I am going with IL-5 because IL-4 there is dupilumab, and IL-5 I think mepolizumab is also there. So you can go with any of the two options, but the correct option here is IL-5. A child presents with visual disturbances. Imaging reveals a suprasellar tumor. Histopathology shows wet keratin, grease oil, wet keratin. These are the keywords. See, this is the keyword. With this only diagnosis is made that this is a case of craniopharyngioma. And among the options, meningitis won't be just suprasellar. Optic nerve glioma will be in the optic canal or will be in the orbit. Medulloblastoma in the base of the skull. So by ruling out options also you can mark the correct answer. A patient with an asymptomatic plaque on face characterized by central atrophy which is slowly progressive since last 2 years. Chest x-ray shows apical calcification. Keyword apical calcification. So this could be a case of cutaneous tuberculosis which is endogenous in source because the TB is present in the lungs. What is the next step of diagnosis? To confirm the diagnosis, I think in the question it was the best test to confirm the diagnosis. So, Mantu test is the next step, but the best test to have the diagnosis is PCR, even better than biopsy. Biopsy is not mentioned in the option, but if I am not wrong, in the actual question, biopsy was also there in the option. So biopsy also has a good specificity and sensitivity, but in this case PCR has a better specificity nowadays. Do subscribe to my channel if you are finding this video to be helpful. A man admitted with fever complaints and this clinical feature, the fairies wheel. So where you see it in histoplasma. And this is also given in my digital image bank. It was also a previous year question because histoplasma came with molluscum contagiosum like lesions and had a lung involvement in our year NEET PG. A 5-year-old girl brought by her mother with complaints of intense nocturnal pruritus. Microscopy shows stool sample with these eggs. Nocturnal pruritus in the perianal region, it is interobius, and the D-shaped, lens-shaped eggs. This is also seen in interobius. So the answer is interobius vermicularis, and this was also given in my digital image bank. So this was up for today. If this video was helpful, then do subscribe to my channel. If I get 50 plus subscribers, then I will upload the part 2 video of this also. All the best for your NEET PG.